and welcome to the next lecture of the endocrinology series. So, in the previous lectures we have discussed about several glands including adrenal gland, but we have not talked about the disorders of adrenal gland. So, welcome and let us now understand about adrenal gland disorders. Myself Amrita Bakshi from University of Delhi. So, number one is the Cushing syndrome, which occurs due to the hypersecretion of cortisol. If you could recall the previous lectures, I have told you that cortisol is produced from the adrenal portion. It is a glucocorticoid and is produced from the zona fasciculata. So, what happens whenever there is hypersecretion of cortisol? You can very easily make out if you remember the functions of cortisol. So, we have seen that cortisol was one hormone which is regulating the metabolism of not only carbohydrates but also fats, proteins, and is also regulating the immune functions. Hence, whenever there is hypersecretion of cortisol, what you can think of? The condition would be elevated breakdown of muscle proteins. There will be redistribution of body fat, because of which you will find out that the arms and legs will become spindly. The fat gets deposited on the back region, because of which there will be buffalo hump. The face, you can see this person, the face will become like a moon, it will become rounded. The abdomen will become hanging and the skin will become flushed with blood. There will be a lot of stretch marks all over the abdomen, and these persons would get very easily bruised with a poor wound healing, because if you could recall, I told you that the cortisol slows down the wound healing. Now, if there is more amount of cortisol, you can think that wound healing will become so poor. Here is yet another schematic representation of a patient suffering from the Cushing syndrome. So, increased cortisol will definitely lead to hyperglycemia. So, this patient would be having diabetes also. There will be very fragile bones, because of which osteoporosis is observed. They will be extremely weak with a lot of mood swings. They will have higher blood pressure and will have increased susceptibility to infections, because the cortisol, what was the function of cortisol? It is immune suppressant. So, that these patients will have increased susceptibility to infections. They will have decreased resistance to stress. So, this is Cushing syndrome, which occurs due to increased levels of cortisol. But there is another syndrome which occurs because of the hyposecretion of glucocorticoids along with aldosterone, and that is referred to as Addison's disease, also known as chronic adrenocortical insufficiency, which mostly occurs due to the autoimmune disorders, wherein the antibodies will be generated in the body that cause the adrenal cortex destruction, or will in other way block binding of the adrenocorticotropic hormone to its receptor. This usually occurs because of the pathogens like Mycobacterium tuberculosis. They may trigger adrenal cortex destruction. So, what happens in this Addison's disease? The first thing is that the symptoms generally do not appear until 90% of the adrenal cortex gets destroyed. But these patients who would be having less amount of both, that is glucocorticoid as well as mineralocorticoid, will show mental lethargy, anorexia, nausea, vomiting, weight loss, low sugar levels, hypoglycemia, muscular weakness. Because there is no or less mineralocorticoid, there will be increased levels of potassium but decreased levels of sodium in the blood, because of which their blood pressure will be low. Dehydration is generally observed in these patients with a decreased cardiac output, arrhythmia, and hence cardiac arrests. Also, their skin appear bronzed, just like suntan. So, how this can be treated is by replacing the glucocorticoids and mineralocorticoids, and by increasing the amount of sodium in the diet. Then comes the cancerous state of chromaffin cells, also referred to as pheochromocytomas. These are actually the benign tumors of chromaffin cells, which leads to the hypersecretion of epinephrine and norepinephrine, because of which there will be prolonged fight and flight responses. So, there will be rapid heart rate, increased blood pressure, increased blood and urine glucose levels, increased basal metabolic rate, flushed face, nervousness, sweating, decreased gastrointestinal motility. The only way of treating these tumors is to surgically remove them. And then comes the very important disorder, that is congenital adrenal hyperplasia. So, as the name itself suggests, it is a genetic disorder which occurs because of the mutation in one or more enzymes involved in cortisol synthesis. So, there will be lack of cortisol in the body. Now, since the cortisol levels are less, there is no feedback, negative feedback to ACTH, to the pituitary cells, and hence ACTH gets secreted in large quantities from the anterior pituitary. Now, what does this ACTH does then? It will go and stimulate the growth and secretion of cortex, because of which you will see that the adrenal glands become enlarged. But there will be no secretion of cortisol because the enzymes are missing. So, what is observed in such patients? You will see that the virilism is very common. So, masculinization is observed in case of females. There will be beard, there will be deeper voice, masculine distribution of body hair. There will be clitoris growth similar to that of the penis. The breasts will get atrophied and the physique would be masculine. Now, in prepubertal males, they will show some features of the females. Then there is some rapid development of male sexual organs and emergence of male sexual desires. In case of adult males, there are normal virilizing or masculine effects, and hence it is difficult to diagnose in case of males. So, what can be done? The treatment is simply replace the hormone which is missing, that is, give the cortisol. So, this will inhibit the ACTH and thereby it will reduce the production of adrenal androgens. Now, just look at the figure. Can you make out what would be the sex of these two persons? These are actually the sisters with congenital adrenal hyperplasia. So, these females are suffering from CAH, wherein there is the masculinization occurs. So, you can see that they appear similar to males. So, this is all about the adrenal gland, and now let us move on to our next gland, which is the endocrine pancreas. Now, the endocrine pancreas, other than being endocrine in nature, you already know that it also has certain cells which are exocrine. It is somewhat a flattened gland with length of about 12.5 to 15 centimeter, and it is located in the curve of the duodenum. It consists of the head part, the body part and the tail part, as can be seen here in the figure. Now, 99% of the exocrine cells of the pancreas, they are arranged in the clusters called as acini, which produce digestive enzymes. Now, among these acini are scattered somewhat around 1 to 2 million tiny clusters of endocrine tissue, which are referred to as pancreatic islets or islets of Langerhans. So, there are pancreatic acini which are somewhat arranged in the floral type. These are responsible for the production of digestive enzymes, and in between these acini lies the pancreatic islets or islets of Langerhans, which is the endocrine tissue of the pancreas. So pancreas, if you look at its development, it develops around 5th to 7th week from the two outgrowths of the endoderm, from the part of foregut that will later becomes duodenum. So these two outgrowths eventually fuse to form the pancreas. So this is somewhat you will find out the arrangement of these cells. You can see here the exocrine acini. These are the exocrine acini, and in between these exocrine acini lies the endocrine pancreas. So there are different types of cells like alpha cells, beta cells, delta cells. There are epsilon cells and F cells. So if you want to identify each cell, then you have to perform the immunohistochemistry by just looking at hematoxylin eosin staining image. You cannot make out that which cell is alpha, which cell is beta. So these alpha cells are responsible for the secretion of your hormone glucagon, while beta cells secretes insulin, delta cells secretes somatostatin, epsilon cells secretes ghrelin, and epsilon cells or F cells secretes pancreatic polypeptide. This is yet another histological image of the cells just to show you the pancreatic islets. Now these, in the endocrine part of the pancreas, the alpha cells or A cells constitute somewhat around 17%, and they are responsible for the production of glucagon. The beta cells constitute around 70% of the islet cells which secretes insulin. Your delta cells or D cells constitutes very less, somewhat around 7%, and secretes somatostatin, while the F cells constitute remainder of the cells in the islet portion which will be responsible for the production of pancreatic polypeptides. Now there is a very small part which is occupied by the epsilon cells which secretes ghrelin. So ghrelin is primarily responsible for eliciting the appetite. Whenever you feel hungry, that is because of a hormone named ghrelin. Now let us have a look at the functions and regulation of the hormones produced by the endocrine pancreas. First of all, glucagon. It is responsible for increasing the blood sugar levels. Now you can think, how can blood sugar level be increased? Definitely by increasing the glycogenolysis which takes place in your liver. So glycogenolysis means breakdown of glycogen in order to give rise to glucose. So this is one way. What can be the other way? Definitely gluconeogenesis, that is the formation of glucose from non-carbohydrate sources. So glucagon actually goes and targets certain enzymes involved in glycogenolysis, and gluconeogenesis increases the transcription of these enzymes, because of which the glycogenolysis and gluconeogenesis increases, thereby the blood glucose levels increase. Now how can the glucagon levels get regulated? Very simple. Whenever there is decrease in the blood glucose level, this will give signal to the alpha cells, and then the glucagon will be released in response to low blood glucose levels. Other than that, whenever you exercise a lot, if you take protein diet, these also will stimulate the glucagon. But there are certain hormones which suppresses or inhibits glucagon also, which includes insulin definitely, because it acts in the antagonistic manner, and then there is somatostatin also. Now the beta cells releases insulin. Now insulin plays the contradictory role or contrary to the glucagon levels. It decreases the blood sugar levels. How? How can blood glucose levels get decreased? Simply by increasing the glucose uptake into the cells, by increasing the glycogenesis, that is the conversion of glucose into the glycogen, by decreasing the glycogenolysis, and definitely gluconeogenesis, by increasing lipogenesis and increasing protein synthesis. So insulin, the primary function of insulin is lowering the blood glucose levels. Now what regulates insulin secretion is whenever there is increased levels of sugar. So if you eat a number of diet, if you take a lot of sweet diet, the sugar level may rise, but it will quickly signal the beta cells to produce insulin, and it will in turn balance your blood sugar level, thereby maintaining the homeostasis. Other than increased blood glucose levels, acetylcholine, some amino acids like arginine or leucine, glucagon hormone, gastric inhibitory peptide GIP hormone, HGH, that is the human growth hormone, and ACTH, all of them can stimulate the insulin production. But somatostatin inhibits the secretion of insulin. Now looking at somatostatin, we have already discussed its role, that it is inhibiting both insulin and glucagon secretion. But somatostatin, other than regulating the hormones, plays a significant role in our digestion also by slowing the nutrient absorption in the GI tract. Now this is very important because absorption requires time. So if you want to increase the efficiency of absorption, the process must get slowed, which is done with the help of somatostatin. And its secretion is inhibited by the pancreatic polypeptide. So PP inhibits secretion of somatostatin. So what is the function of pancreatic polypeptide? Definitely number one is inhibiting the secretion of somatostatin. Other than this, pancreatic polypeptide also plays a significant role in digestion and absorption. It basically inhibits the gallbladder contraction and secretion of pancreatic digestive enzymes. So you can imagine that it is actually doing what? It is slowing the process of digestion. So somatostatin was slowing the process of absorption, but pancreatic polypeptide is slowing the process of digestion by inhibiting the gallbladder contraction and secretion of the digestive enzymes from the pancreas. So what is the function of pancreatic polypeptide is clear, but now how it gets regulated? So whenever there is intake of protein meals, fasting, exercise or acute hypoglycemic levels in the blood, it will stimulate the secretion of pancreatic polypeptide. On the other hand, what will happen whenever there is increased glucose levels, it will lead to the inhibition of pancreatic polypeptide. Other than that, somatostatin also inhibits the secretion of pancreatic polypeptide. So how does the regulation of glucose and insulin work? So there is a very beautiful negative feedback mechanism. So you can see here that whenever there is low blood glucose levels, that is the hypoglycemia, it will signal the alpha cells of the pancreas to produce glucagon. Now this glucagon will go to the liver cells, that is hepatocytes, and will do what? It will do the glycogen breakdown, that is glycogenolysis. Also it will go and act on the different organs which are involved in gluconeogenesis like kidneys, and will ultimately increase the blood glucose levels. When the blood glucose levels are increased, it will give a negative feedback to these alpha cells to stop the production of glucagon. Now opposite to that, just imagine a situation when the blood glucose levels are high, that is hyperglycemia is there. This situation will stimulate the beta cells of the pancreas to produce insulin. Now this insulin will go into the blood circulation and will stimulate the cells to increase the uptake of the glucose by stimulating the expression of glucose transporters onto the cell membrane. So, whenever the glucose transporters come to the cell membrane, they will do the uptake of glucose and thereby lowers the blood glucose levels. Other than that, as discussed before as well, that insulin will inhibit glycogenolysis and gluconeogenesis, but will promote glycogenesis, and thereby it will reduce the blood glucose levels, and when the levels of blood glucose gets reduced, it will again send a negative feedback to the beta cells and signal them to inhibit the production of insulin. Now, after understanding the function of different hormones produced by the pancreas, let us understand some important endocrine pancreas disorders. So, the first one is diabetes mellitus, whose hallmarks include three polys: polyuria, polydipsia and polyphagia. Polyuria means excessive urine production because of the inability of kidneys to reabsorb water. Polydipsia means excessive thirst. So, person will drink a lot of water but will go to urinate as well. Then there is polyphagia, which means the patient will have excessive eating. So, what is the cause behind diabetes mellitus is either inability to produce or use insulin. On that basis, there are different types of diabetes. Number one is type 1 diabetes, which is insulin dependent diabetes mellitus, IDDM. The cause of which is whenever there is destruction of beta cells by the person's immune system itself. Then you can imagine a situation, if there are no beta cells, then there will be no or very less amount of insulin produced by some of the beta cells if present in the patient. The target group of type 1 diabetes is usually the patients or the persons less than 20 years of age, and this condition will definitely persist throughout the life because there are no cells. So, cellular metabolism of untreated type 1 diabetes is similar to the starving person. You will see that there is no insulin, so there will be no entry of glucose into the cells. So, most of the cells will use up fatty acids to produce ATP, definitely, because body requires energy. So, in adipose tissue, you will see that the triglycerides will get broken down into fatty acids, glycerol, and definitely the byproduct will be produced, which is ketone bodies. Now, there is a side effect of the ketone bodies that they accumulate and they causes ketoacidosis, that is, they will decrease the blood pH, and if it is not treated quickly, it will lead to the death of the patient. So, other situation, in other cases, what will happen in such patients? You will see that there will be breakdown of stored triglycerides, because of which you will see a lot of weight loss. Then there is atherosclerosis, which means the lipid particles get deposited on the walls of blood vessels, and there will be a lot of cardiovascular problems in type 1 diabetes, which includes cerebrovascular insufficiency, ischemic heart disease, peripheral vascular disease and gangrene. Along with it, there is loss of vision either due to cataracts, because a lot of glucose gets attached to the lens proteins. This causes cloudiness, or there could be damage to the blood vessels of retina only, leading to the loss of vision. And then comes the kidney problems, which occurs from the damage to the renal blood vessels. How can this type 1 diabetes be treated? Number one is self-monitoring of blood glucose with the regular meals, somewhat around having 45 to 50% of the carbohydrates and less than 30% of the fats, by having some lifestyle modifications like exercise. The other thing is, if there is no insulin, then definitely such patients need to have periodic insulin injections, somewhat 3 times a day also. And the last option is the patient can go for pancreas transplant as well. Then comes the type 2 diabetes, which is non-insulin dependent diabetes mellitus. This is NIDDM. and is more common than type 1, which you observe in 90% of the cases. So, this type of diabetes usually targets the obese people of more than 35 years of age. Now, the clinical symptoms of type 2 diabetes are generally mild, and it can be controlled by doing some modifications in our lifestyle, including diet, by increasing the exercise, regulating the body weight, and definitely there are drugs and medicines available in the market, including glyburide, which is a diabeta market name of the medicine. Metformin is a very common drug which stimulates insulin secretion from pancreatic beta cells. And the last option is insulin injections also if the blood sugar level is not getting regulated. So, in many of such patients there is sufficient or even surplus amount of insulin in the blood. And you must be wondering then why they are diabetic. So, in many of such patients what actually happens is the insulin is there, but the target cells do not express or express in a lesser amount of the insulin receptors. So, such patients will have insulin in larger amounts, but the receptor is not there. So, this situation is referred to as hyperinsulinism, when the diabetic patient will be having larger amounts of insulin. So, hyperinsulinism can also be achieved when the diabetic patient injects too much insulin with the symptoms of definitely hypoglycemia. It will stimulate secretion of epinephrine, glucagon and growth hormone, which will in turn lead to anxiety, a lot of sweating, tremors, increased heart rate, hunger, weakness, mental disorientation, convulsions, unconsciousness and shock. This is what is referred to as insulin shock whenever there is a lot of insulin in the blood or there is overdose of the insulin. So, this is all about the pancreas and the disorders related to pancreas. So, let us quickly revise what we have studied. We have understood that pancreas, the gland, consists of both exocrine as well as endocrine portions. In today's lecture, we have focused on to the endocrine pancreas, which consist of different types of cells, alpha cells, beta cells, F cells, PP cells, which were producing a lot of a lot of hormones including glucagon, insulin, pancreatic polypeptide, somatostatins, ghrelin. We have discussed in detail the functions of glucagon and insulin, how these hormones are getting regulated, we have understood about that. And then lastly, we have discussed about the important disorders related to endocrine pancreas, that is the diabetes mellitus, including type 1 and type 2 diabetes. Thank you.